Welcome to our video on 6 more items you should avoid if you're taking amlodipine or Norvasc. In this video, we will discuss other foods, drugs, and alternative therapies that can interact with amlodipine to either boost or reduce its effectiveness. Please keep in mind that when taking amlodipine, it is critical to be aware of potential drug interactions and understand the medications that may not be safe to combine with this medication. If you find that you need to take another medication while on amlodipine, speak with your doctor or pharmacist about safe alternatives available that can help you manage your condition effectively. They may recommend alternative medications or adjust the dosage to minimize side effects. It is important not to modify your medication regimen without competent medical assistance. It is also vital to understand that every medicine has side effects, and it is ideal to know which are appropriate for you and what to avoid when taking them. Before we begin, amlodipine is a medication that is commonly used to treat high blood pressure and chest pain by lowering blood pressure. It lowers the risk of cardiac complications, stroke, and kidney disease. It belongs to a class of drugs known as calcium channel blockers, which work by relaxing and widening blood vessels, allowing blood to flow more easily. The principal enzyme responsible for metabolizing amlodipine is CYP3A4, which is present largely in the liver. It oxidizes amlodipine into inactive metabolites that do not contribute to its blood pressure lowering effects. It is crucial to note that various drugs and substances might alter amlodipine metabolism, which we shall explain in this video. Now, let's talk about what you should avoid if you're taking amlodipine. Number 1. Ginseng. Ginseng is a popular herbal supplement derived from the roots of the Panax ginseng plant. It has been used for centuries in traditional medicine to improve physical stamina, boost immune function, and improve mental performance. It contains active compounds known as ginsenaceae, which are thought to be responsible for its many health benefits. Ginseng has been shown to activate several liver enzymes important for drug metabolism, including amlodipine. This indicates that taking ginseng alongside amlodipine can boost the medication's metabolism, result in reduced amlodipine levels in the bloodstream. The effectiveness of amlodipine in decreasing blood pressure and treating hypertension may be hampered. It is important to remember that everyone's body reacts differently to drugs and supplements, and although some people may not experience any negative effects from mixing ginseng with amlodipine, others may. Others may face major difficulties. Before using ginseng or any other herbal supplement with amlodipine, please speak with your doctor or pharmacist. Number 2. High-fat dairy products. Amlodipine absorption into the bloodstream is impacted by a variety of circumstances, including the availability of high-fat dairy products in the digestive system. When high-fat dairy products are consumed, the digestive system suffers. The presence of fat delays the pace at which the drug is absorbed and might result in a drop in the concentration of the medication. Amlodipine in the bloodstream, resulting in a reduction in its effectiveness. Furthermore, the liver is important in the metabolism of amlodipine since it breaks down the drug, inactive metabolites that are excreted from the body. However, high-fat dairy products can interfere with this process. The liver is responsible for metabolizing dietary fats, and if it is busy breaking down these fats, it may be unable to effectively metabolize an amlodipine. As a result, the medication may stay in the body for longer than intended, potentially leading to side effects or even toxicity. Number 3. Echinacea. Echinacea is a well-known herbal supplement that has grown in popularity due to its possible health advantages, notably its immune-boosting characteristics. Echinacea is typically used to treat symptoms of the common cold, such as sore throat, cough, and fever. It is also considered to have antiviral and anti-inflammatory effects during cold and flu season in the hopes of warding off sickness and strengthening their immune system. Combining amlodipine with Echinacea may bring health hazards. It is critical to be aware of these risks before adding Echinacea to your daily regimen if you are currently taking amlodipine. One of the main concerns is that Echinacea may interfere with the effectiveness of amlodipine. Amlodipine works by relaxing and widening the blood vessels, which helps to lower blood pressure. However, Echinacea has the potential to counteract this effect and could potentially lead to an increase in blood pressure. This could undermine the benefits of taking amlodipine and may have adverse effects on your overall health. If you are allergic to Echinacea and continue to take it while taking amlodipine, it may worsen your allergic reaction and cause severe symptoms such as difficulty breathing or swelling of the face, lips, tongue, or throat. To ensure your safety and well-being, consult your doctor or pharmacist before combining amlodipine and Echinacea. They will be able to assess your particular health condition, drugs, and any hazards. Number 4. Licorice root. Licorice root, also known as Licorice glabra. This versatile herb has been used for centuries for its medicinal properties and unique flavor. It can help soothe irritated tissues and reduce inflammation in the body, making licorice root a popular remedy for conditions such as sore throat, cough, and digestive issues. Licorice root includes a chemical called glycyrrhizin, which can raise levels of a hormone called aldosterone in the body. Aldosterone is a hormone that regulates fluid and electrolyte balance, particularly salt and potassium balance. The combination of licorice root and amlodipine can raise aldosterone levels, causing salt retention and potassium loss. Fluid retention can result from salt retention, rising blood pressure and increasing blood volume potassium loss. On the other hand, can result in low potassium levels in the blood, which can cause muscular weakness, irregular pulse, and other cardiovascular difficulties. Furthermore, licorice root can hinder the breakdown of amlodipine in the body, resulting in increased levels of the medicine in the bloodstream, which might raise the risk of amlodipine side effects such as dizziness, headache, and flushing. Number 5. Macrolide antibiotics. Macrolide antibiotics, on the other hand, are a class of antibiotics that are often used to treat bacterial infections. They operate by blocking the growth of bacteria, allowing the body to fight off the illness. While both amlodipine and macrolide antibiotics are excellent treatments in their own right, they should not be used simultaneously. The rationale for this is the possibility of hazardous medication interactions. Macrolide antibiotics, such as erythromycin and clarithromycin, may interfere with amlodipine metabolism, resulting in higher levels of amlodipine in the system, increasing the risk of adverse symptoms such as dizziness, low blood pressure, and an irregular heart rhythm. Number 6. Ketoconazole and itraconazole. Ketoconazole and itraconazole are antifungal medications. Ketoconazole is used to treat a variety of fungal diseases, including skin, nail, and hair infections. Itraconazole, on the other hand, is used to treat a broader spectrum of fungal infections, including those of the lungs, mouth, and throat, as well as the nails. These antifungal medications act by preventing fungal cell development and reproduction, hence removing the illness. A study published in the Journal of Clinical Pharmacology looked at the effects of co-administering amlodipine and ketoconazole in healthy people. The researchers discovered that ketoconazole significantly increased the plasma concentration of amlodipine, which means that amlodipine levels in the blood were much higher than expected. Higher amlodipine levels may increase the chance of undesirable consequences effects. Another study published in the British Journal of Clinical Pharmacology studied the potential interaction between amlodipine and itraconazole and reported that itraconazole similarly elevated blood pressure, identical to what was seen with ketoconazole. The plasma levels of amlodipine was identical. According to the findings, both ketoconazole and itraconazole can decrease the metabolism. It is critical to consult with your doctor or pharmacist before combining amlodipine with ketoconazole or itraconazole, as they will be able to assess your specific situation and advise on the best course of action. Thanks for watching. If you enjoyed this video, like, comment and subscribe, and click on the bell icon so you never miss any of our videos.